Hello, welcome to chapter 24. This is the immune and lymphatic systems and cancer. This is day 12B. As usual, we start with section 2. If you can open your textbook and follow along. Remember to make notes and write questions out so you can ask your instructor. So immune system, lymphatic system, and cancer. Explain the structure and function of the immune and lymphatic systems. So what are the points to know about the immune system? The immune system protects the body from harmful substances. There are some immune system present at birth, from when we're born, that kind of begins to build the immune system. And after that, we get some immune system from our mothers through breastfeeding and so on. Specific immunity is acquired by the body and manufactures antibodies as a response to an antigen in the body. With active immunity, vaccines cause the body to produce antibodies to protect against a particular disease. With passive immunity, a person is given the antibodies needed to defend against the antigen. So here's your diagram of the lymphatic system. Just lymph nodes and lymph vessels that's all over the body. Okay. The lymph, a clear yellowish fluid that carries disease-fighting cells called lymphocytes. Points about lymphatic system: removes excess fluids and waste products from the tissues, helps the immune system fight infection. The thymus gland makes T cells, which attack and destroy specific types of pathogens. Protect against the invasion of foreign substance and pathogen. Return extra fluids to the circulatory system. Normal changes in the aging as far as immune and lymphatic systems are concerned. The immune system weakens, causing increased risk of all types of infection. You've heard about the coronavirus and you've heard the experts, Dr. Fauci and the rest, talking about the elderly are more at risk. They are more vulnerable because their immune system is weak or because they have underlying conditions. Antibody response is slow. T cells decrease in number. Response to vaccine decreases. So you have to be careful, because the elderly are more vulnerable. So when you're providing care, make sure you yourself, you're not sick, and take the sickness to them. We've heard cases in the nursing homes where the resident did not go out. So how did they get the coronavirus? Staff members brought it from other places. They got it, probably didn't know they had it, and then they take it to the nursing homes and hospital. So be careful. Some common disorders of the immune system: AIDS, acquired immune deficiency syndrome. This is the final stage of HIV infection, in which the infection, the tumor of the central nervous system, symptoms appear due to a weakened immune system. Then you have the HIV. It's a virus that attacks the body's immune system and gradually disables it, eventually causing AIDS. Points to know about HIV and AIDS: HIV attacks the body's immune system and damages or destroys cells, causes HIV virus. The cause: HIV virus, acquired through blood or body fluids from an infectious person. And then AIDS is the final stage of HIV. So you get HIV first, then it becomes AIDS at the end. Know the most common methods of transmission of HIV. We know that the most common method is unprotected anal sex with an infected person, unprotected vaginal sex with an infected person, sexual contact with many partners, sharing drug needles and syringes. In a healthcare setting, infections can be spread through accidental contact with contaminated body fluid, needles, or other sharp objects, or contaminated supplies or equipment. I've seen a colleague at work was trying to recap the needle after she finished giving an injection, and she stuck herself with the needle. So never recap a needle. Just drop it in the biohazard container without trying to put the cap back on it. Yeah, some myths about HIV and AIDS. You can read through that. It's in your textbook. So let's move on to remember AIDS. So remember that HIV is not spread in any of these ways. Some people have this phobia about HIV. Some people think just by touching someone that has HIV, they're going to get it. No, you're not. So it is not spread through the air, water, or food. Not by pets or insects, not by saliva, tears, or sweat. Not through casual contact such as hugging, shaking hands, sharing dishes, or touching doorknobs or toilet seats. Not through closed mouth or casual kissing, or like kissing somebody on the cheek. So now the following ways are ways to protect against this spread of HIV. Practicing standard precaution. Remember standard precaution, we studied that during infectious disease. I think that's chapter 6. You have to know that when you're providing care, you need to use standard precaution, which means treat everyone as if they're infected. You're not sure, so protect yourself by wearing your protective equipment, especially gloves. Handling and disposing of sharps properly, covering cuts, sores, tears, breaks, rashes before caring for a resident, never sharing needles, not having unprotected sex, staying in a monogamous relationship, practicing abstinence, getting tested for HIV and retested if necessary. Signs and symptoms of HIV infection: flu-like symptoms, headaches, blurred vision, loss of appetite, nausea, vomiting, weight loss, night sweats, shaking, chills, dry cough, shortness of breath, swollen limbs, sore throat, cold sores, mouth sores, white patches in the mouth, like cauliflower-like warts on the skin and in the mouth. Bleeding, inflamed gums, yeast infections, skin rashes or sores, bruising that does not go away, dry skin, memory loss. Opportunistic infection. These are infection caused by microorganisms due to a person's inability to fight the infection. So people with weakened immune system due to HIV/AIDS may get opportunistic infection or disease that a healthy person would be able to fight off. Autoimmune disease, a disease in which the body is unable to recognize its own tissue and begins to attack the tissues. Points to know about autoimmune disease: the body is unable to recognize its own tissue, then attacks it. An example, systemic lupus erythemosis and rheumatoid arthritis. The causes are unknown, but maybe genetic links, microorganisms, or medications that act as triggers. Signs and symptoms: fever, fatigue, dizziness. There are some medications and blood transfusions that can treat it. Obesity increases the risk for almost everything. Immune system disorders, kidney problem, prostate, breast, endometrial and ovarian cancers, all these types of cancers. So it's very important that we keep our weight within normal range. Very important that nursing assistant follows standard precautions. We said that before. With every single resident in their care, if a CNA does this, there should be no difference in the care given to a resident with or without any kind of infection. Follow standard precaution. Cover all broken skin. Wear PPE. Wash your hands. Handle and dispose sharps carefully. Remind residents and visitors to wash their hands. Do not share residents' personal items and disinfect surfaces properly. Homophobia is a fear of homosexuality. We talked about this already. Guidelines caring about HIV/AIDS. So we're going to move forward on that. So report any of these symptoms to the nurse. Change in vital signs, especially fever, loss of appetite, reduced intake of fluids, weight loss, dysphagia, mouth sores, bruising of the skin, and so on. Cracks, breaks, rashes, lumps, pressure ulcers, bleeding from anywhere on the body, blood in the stool, nervousness, withdrawal, behavior that puts residents or others at risk, suicidal thoughts or comments they make. Cancer. So cancer is a general term used to describe a disease in which abnormal cells grow in an uncontrolled way in the body. So a tumor is a group of abnormally growing cells. If it's benign, meaning it's in one place, it's non-cancerous. Malignant means it's cancerous. It can, spread. Metastasize to spread from one part of the body to another. Fact about cancer usually occurs in the form of a tumor that grows on or within the human body. Tumors are either benign or malignant, can act in different ways. It can metastasize or spread. Know the risk factors for cancer. Genetic factors, like people with breast cancer, whose parents had breast cancer, are likely to have it. Certain lifestyle choices such as tobacco can cause lung cancer, alcohol use, poor diet, obesity, lack of physical activity, certain infections, environmental exposure such as radiation, sun exposure, and so on. Signs of cancer: unexplained weight loss, fever, fatigue, pain, skin changes, change in bowel and bladder function, sore that does not heal, white patches inside the mouth, unusual bleeding, discharge, any thickening in the breast, testicle or other areas, indigestion, difficulty swallowing, new mole or change in appearance, nagging cough or hoarseness. Biopsy is the removal of a sample of the tissue for examination, for a test, for diagnosis. Remission is the disappearance of signs and symptoms of cancer or other kind of disease. It can be temporary, like when you hear the cancer is in remission, that means the signs and symptoms are not present, but it could be temporarily, or it could mean that it's permanent, the person is cured. A diagnosis of cancer is made after various tests, such as biopsy. After a diagnosis of cancer is made, the treatment plan is developed, maybe chemotherapy or, various types of treatments of cancer: surgery, radiation therapy, chemotherapy, hormone therapy, immunotherapy, and so on. Again, follow standard precaution. Wear PPE when you're taking care of a cancer patient. Observe skin to prevent pressure ulcer. Observe position, change position every 2 hours as directed. Follow special skin care orders exactly. If they are taking radiation or chemotherapy, there are parts of the skin that water should not touch. So be careful. Use special mattresses or pads in beds and chairs to reduce risk of pressure ulcers. Keep skin clean and dry. Apply lotion to dry skin. Do not use lotion on areas receiving radiation therapy. Do not remove any markings used with radiation therapy. Report signs of infection to the charge nurse. Give oral care often. Be gentle. Use soft brushes or special swabs. Use mild mouth rinses to reduce bad taste from medication or vomiting. Nutritional guidelines for residents with cancer: provide small, frequent meals to reduce nausea and prevent weight loss. Serve favorite foods and snacks. Provide food when they are hungry. Try cool or cold food. Cut foods into small pieces. Use plastic utensils. Weigh residents as ordered, and report any weight loss or any weight gain. Encourage fluids. Monitor the intake and output and report changes. Guidelines for bladder and bowel changes: assist residents with toileting. Change catheter if they are on catheter as needed. Carefully measure output. Test stool for cord blood as ordered. Guidelines for mobility of residents with cancer: allow plenty of time for rest. Don't rush them. Recognize limitations, don't push them too much. Assist with ambulation. Breakthrough pain, when somebody have cancer and they're receiving those chemotherapy or radiation, they're going to be in pain a lot. A breakthrough pain is a type of severe pain that happens unexpectedly in people who have cancer. It will just come all of a sudden, and then they need to have a very strong type of medication, pain medication, like Percocet. Cancer can cause severe pain, like we said. It can affect the ability to sleep, eat, move. Medications and other measures are used to treat pain. Observe and report signs of pain in residents with cancer. Be alert for signs of pain and report immediately. You don't want them to be in pain for a long time, so keep an eye on them frequently. Provide comfort measures like back rub, repositioning, play soft music, read to them, talk to them, maintain a quiet environment. Notify nurse of side effects of the pain medication. Any irritation around the patches should be reported to the charge nurse. Observe for redness, swelling, warmth around the insertion sites if they have like a PCA pump. PCA pump is like a medication pain medication that the resident can press for the pump to deliver the pain medication. Report signs of breakthrough pain. Monitor vital signs, especially temperature. Report changes in vital signs to the nurse. Help residents stay clean and well groomed. Offer them wigs, because with the cancer treatment they're gonna have hair loss. So maybe they want to wear a hat or a scarf. Assist with application of makeup as requested. Understanding the mental status and meeting the emotional needs of a resident with cancer. Be sensitive to the resident's wishes. Listen if they want to talk about it. Spend as much time as possible with them. Encourage activities. Ask the social worker about support groups. Encourage family also to be involved. They should visit frequently. When you're communicating with them, do not use cliches. Provide support during painful episodes. Remind residents that there can be good days ahead. Observe and report signs of depression or comment about suicide to the family or to the charge nurse. Symptoms to report: pain or increased pain, changes in vital signs, signs of new bumps or lumps, rashes, cracks, sore throats, breaks on the skin, odors, burns, bruising, difficulty with ambulation, fainting, increased fatigue or weakness, chest pain, tiredness, shortness of breath, changes in appetite or weight loss, difficulty chewing or swallowing, dry sore throat, inflammation, bleeding, nausea and vomiting, diarrhea, constipation, flatus, that's passing too much gas, blood in the stool, change in output, changes in the urine color or blood in the urine, urinary tract infections, change in mental status or confusion, anxiety, fear, depression, and so on.